I'm downtown Des Moines during lunch hour. I'm going to go inside and grab people and see what questions they have for you, Dr. Joe.
I'm just curious as to, is chiropractic kind of like a lifestyle thing where there are home things that you do as well, or is it just where you visit a chiropractor and he does work on you and you really don't change how you live? Is it both and, or is it just the visiting?
And that's also a great question. I gotta tell you, I'm just so impressed with the questions that we're getting here. The answer to this really, again, and I'm not hedging here, but it does depend upon the patient. Most chiropractors should be giving the patient some things to do at home. We divide this up into two types of care. We call it active and passive. Passive means you just lay there and the chiropractor works on you.
Sure.
Active is something that you have to physically do yourself. And usually this is in the way of exercises that are both stretching and strengthening, but we also have lifestyle recommendations. Proper way, sleep posture, driving, standing, sitting, all these things, ways to avoid injuring your back. Now, in the reality of it all, I hate to admit, is that some chiropractors don't do this, most do, but most patients don't follow through.
I was going to ask you, do the patients really do the things they're supposed to do?
Most of the time, no.
And you know that, right?
Yes, I do. I do. And in fact, I'm guilty of it myself. It's sort of human nature. When you're hurt, you do the things, and then you feel better, and you just sort of stop doing them.
Sure.
So, but what this does, though, is it gives me what I like to call finger-wagging privileges. Because if your complaint comes back, and I say to you, Melanie, have you been doing the exercise? And you say no, I go, well, that's why it came back. So I get to blame you rather than you blaming me.
Dr. Joe, John has a tough question for you.
Okay.
I've always heard that chiropractic is kind of based on pseudo-medicine, that most of the problems that a chiropractor would address should be addressed by an orthopedic doctor. I'd kind of like to hear what you have to say about that.
John, I really appreciate your candor on this, but I'm going to give you a very emphatic no. And the reason for that, I think, is pretty simple. In fact, I'm going to flip it around, and I'm going to say that when an orthopedist sees you as your doctor and they're not doing surgery, they're being a pseudo-chiropractor. And the reason I say that is simple. The actual title is orthopedic surgeon. When someone has surgeon in their title and you go to see them for something, essentially they're looking to see whether or not you are a candidate for a surgical procedure that they think will help you. Mm-hmm. If you are, they might go ahead and recommend that procedure. If you're not, they really don't have a lot of other things to do. They may send you to physical therapy, or they may prescribe drugs that we consider dangerous. And you should watch session 1 again on our first episode, where we talk about the dangers of Aleve and Advil and aspirin. These are not safe drugs, even when used properly sometimes, but when used excessively, they really are dangerous drugs. And so what I would say is it doesn't make sense to go to a surgeon first. That what you should do first is visit someone that doesn't use drugs, doesn't use surgery, and may have an answer for you. If that fails, you can always go to the orthopedic doctor. In fact, doctors of chiropractic are trained to know when to refer to a surgeon. So if you need a surgeon and you go to a chiropractor, odds are you're going to wind up at the surgeon anyway.
Great. Well, thank you, Dr. Joe.
Thank you, Melanie.
I hope you got some of your questions answered. Now, if you have any more questions, you can stop in the Ferezy Clinic in Windsor Heights or check out Dr. Joe at theferezyclinic.com.